Hi, welcome back. Good evening, good afternoon, and good night from wherever you're watching. I'm your host, Celesta Mary _RN, and today I'm so glad to be with you. I'm happy for you to have tuned in. I want you to like, to share, and to subscribe to my channel. Your health is your health. Celesta Mary _RN. So I am so glad I've been answering questions. I thank you for all of you who have been tuning in. Thank you all who have subscribed. Thank you all who have been listening to me. And I'm so glad to get your feedback. And I'm very happy that today you're going to learn even more. So, over last month and part of this month, we have been learning the vital signs. And I just want us to wrap up the issue of vital signs. There is a vital sign that is so important that we need to learn about. This is called blood pressure. I chose to make it the last amongst all the vital signs. So we will be learning about blood pressure. How well do you know your blood pressure? How can you control your blood pressure? What is this blood pressure that you're learning about? So I want you to stay tuned as we continue to learn about blood pressure, the fourth vital sign. Tune in and share. Hi, welcome back. This is your host, Celesta Mary _RN. We are talking about blood pressure. What is this blood pressure? So, blood pressure, this is the pressure that normally occurs within your heart, into your arteries, and to your veins. The pressure of blood from the heart into your arteries and to your vein. Normally, it can be very high or it can be low, but you need to know what are the normals. Now, scientifically, a normal blood pressure is measured systolic and diastolic. So you normally have an upper value and a lower value. So when the upper value, ideally in a normal adult like me, you should have a range of between 100 to 140, the upper value. The lower value should be between 60 and 90. When the upper value is between 100 or 140, then we say you have normal blood pressure. Your systolic level of the upper value is normal. However, when it is below 100 or it is above 140, then it is a tell sign to me, who is a healthcare worker, to me, who will be taking your vital signs, to enable you to know that there's something that is happening. Your blood pressure are extra high or they're not within the normal ranges. The lower part of your blood pressure, if it's between 60 to 90, if it's below 90 or it's above 90, then we say maybe you have hypotension or hypertension. So it's always good to know what is the upper value, what is the lower value, and what are the ranges. Blood pressure. So what are some of the things? Blood pressure is measured in millimeters of mercury. That is how we will tell you it is 120/80, but we call it millimeters of mercury. We put it as mmHg. For those of us who like chemistry, that is how we rate blood pressure. So we have an upper value over a lower value, and then the other sign is millimeters of mercury. Just for good for you to know as a layman, what is this that they're talking about? They're saying I have a high blood pressure, I have a low blood pressure. So it's good to always know what are the normal ranges, what are the low abnormal ranges, so that we can act accordingly. And I say in this world, it can never be very high or it can be very low. And anything that goes out of the range is risky. It is not good. So that is why it is good when you go to the hospital, they take your blood pressure. It's always good for the doctor to advise. That's why you ask questions. I know of my friends who tell me, Celesta, whenever we come to hospital, we ask several questions, many questions. In fact, wanasema maswali ya clinic. I have friends who say, hiyo maswali yenu ni ya clinic. As in, those questions are too much. But you know that the questions that a nurse or a healthcare asks are important because they tell us so much about what it needs to be done, whether the pressure we are getting is really normal or there's something else that has caused it. So it is good to know what is the normal range, and get a history of what is happening. So the other question that will come in, how is a blood pressure measured? Now we have a machine called sphygmomanometer. Now this is a machine that you put a cup around your hand, here this part, and it is advisable that you have to remove the clothes, or rather push your hand so that your hand is bare. Blood pressure should not be measured with clothes, should not be measured with your jacket on. So clothing should be removed. The cuff, we normally call it the cuff, that thing that you put around your arm. Then the healthcare giver should ensure that they are palpating the brachial artery. There's an artery here. So where they can palpate, that is where the cuff should be, and that thing that points to it, so that the blood pressure is taken the right way. So remember, there should be no clothes on. Again, we should make sure that we are aligning it to the brachial artery. Why? So that we are able to get exact, because the artery goes into your heart. So we get to know the exact blood pressure, and it's measuring the right thing. How much blood is pumping from your heart to the rest of your body. So very key. Now, we have cases whereby, like during the COVID season, you'll find that people are no longer removing clothes. You're just measuring on top of it. Why? Because of infection control. There could be many other reasons that could cause you to do a blood pressure on top of the hand. So we need to know about that. But ideally, remove any clothes that are there. Number two thing that you need to know, apart from knowing that the arm is empty or the arm has no clothes, anytime you take a blood pressure, you should put your hand on a surface so that your elbow is in line with the heart. So blood pressure should not be measured when your hand is down like this and then they take a pressure, but it should be measured in such a way that you're in a place whereby it is on the level, your elbow and your heart at the same level, so that you get the correct blood pressure. So not very high like this. Nobody should take your blood pressure when your hand is raised up, or too low, but it should be a level of your heart. And your heart is on your left side of your heart, the left side of your arm. So this is where the heart is, at that level. Another thing that is important about taking blood pressure, your arms, your feet should be on the ground. You should not cross your feet as you're taking blood pressure. Why? Because it increases the venous return. That one is for us who are medics, know that. So whenever you're taking blood pressure measurement, do not put your feet, don't cross your legs. Put them all on the floor. Very important, especially when you're taking your blood pressure when seated. We have people who cannot sit down. They are sick in the hospital, so their blood pressures are taken when they're lying down. So even when you're lying down, your legs should not be crossed. Your legs should what? Should all be parallel. Why? Because of the increase in venous return, it can give wrong readings to your blood pressure. Very, very key. So what are we learning? We are learning that we have a normal range for blood pressure, that is between the upper range is 100 to 140. Anything beyond or below is abnormal. And we also have the lower range. Anything beyond 60 or above 90 is also abnormal. What are we learning? That blood pressure should be taken on the left arm, preferably. We have cases of patients who you take the blood pressure on the left arm, and then you take on the right arm, and you find there changes. If you're not so sure, you need to take on both sides, just to be sure, while lying down, while seated down, all those ranges, they should not be above 13 millimeters of mercury, because that will tell you that there's a problem that is happening. Very, very important. Now, blood pressure in some cases can also not only be taken on the arm, which is the common one. For patients who walk into the hospital, who are at home, sometimes the blood pressure can be taken on your feet. When you have burns on your hands, people who have got maybe cancer of the breast, you cannot take the blood pressure on that arm, or if you've done all the breasts have been removed, you cannot check blood pressure. You can also use the feet to check the blood pressure. Remember, it is measuring the pressure of blood from the heart into the rest of the body. So still, you can use your extremities to measure or check the blood pressure. So I've said, number two thing, do not cross your feet, your legs, put them parallel if you're lying down, or if you're seated, let all your feet be on the floor. because crossing increases venous return and give wrong readings. So the range might go extremely high or extremely low. It is very, very important. Another thing that before your blood pressure is taken, you need to avoid things that stimulate your heart rate. Remember the last episode you're talking about heart rate. So what do you need to do? Do not take coffee. Coffee is a stimulant. This decaffeinated coffee, carbonated drinks, all of them, they help to stimulate your heart rate and also increase your blood pressure. So anything that increases chocolates, all these that have got caffeine in them, things that have got carbonated drinks, those things help to increase the blood pressure. So it could be your blood pressure is normal, but because you just took a full cup of 300 ml of coffee, your blood pressure will appear high. So it's always good when you're asked, what have you eaten? What did you do? Have you taken anything since you came to the hospital? All those questions help us know that this one, we need to wait for the coffee to come out of your blood system for us to measure again, or we need to consider that margin that this increase by 10% is because the patient took coffee or something like that. So I want you to stay tuned as we continue to learn about blood pressures. Share, like, and subscribe. Welcome back to my channel. This is your host, Selesa Mary _RN. I am your nurse educator. I'm a nurse mentor, and it's my joy and pleasure to give information or knowledge to you, my listener, so that you are well knowledgeable, you're well equipped, so that you know what to do and how to act, because your health is your priority and your health is your wealth. Remember, if you do not take good care of your health, then things are bound to happen that you will not like. So, what are some of these things that when my blood pressure is taken can make it to be too high or too low? Number one thing that has an effect on your blood pressure is age. How old are you? So in the hospital, when you're being asked your age, I know we women do not like to be asked about our ages. But when you're in the hospital, be honest as much as possible and tell them, I am 40, I am 30, I am 20, I am 50 years, because that already is an indicator. So that when I see your blood pressure is not within the range, then I'll know maybe because you are 50. Because the higher you grow or the more you age, the more your blood pressure increases. That is science. So a small child has a lower blood pressure from a teenager. A teenager has a lower blood pressure from an adult. So your blood pressure increases as you age. So age increases the blood pressure. So be honest with your age so that you can be helped. Another thing that also is important is gender. I know right now with the LGBTQ, we have people who have the other gender called other. However, it is good, it has been known scientifically that women have got lower blood pressures than men. Did you know that? One of the reasons that has been contributed or has been said to lead to women having lower blood pressures than men is because of our hormones. We have several hormones within us that somehow make our blood pressures to go very high. Men, as opposed to women, have got major higher blood pressure. So if you happen to get a gender, it will can easily tell you. If you check a female's blood pressure and you check a male, both of the same age, maybe they are twins. We have twins, a boy and a girl, and then you're taking the girl twin, the pressure is 100/60, and the other twin is 140/90. You just consider that this one is male because male tend to have what? Higher blood pressures than female. Important to know. What about blood volume? The volume of blood within you. People who get accidents, if you're bleeding too much, you bleed so profusely, you've got an accident, there's a stab because you get so much of that in the hospitals, Either you're bleeding because a woman maybe is losing a child and they're bleeding too much, they've lost through miscarriage. When there's heavy bleeding, then your blood pressure goes down. Why? Because the volume of blood that is supposed to circulate in your system is no longer there. So already automatically your blood pressure will go down. Another thing that affects your blood pressure is stress. Stress increases your heart rate. Stress increases your blood pressure. So if you're stressed out for some reason, you need to look for help. You need to follow up. In this world, we have got so many things that stress us, but you need to know how to manage stress. But if you're not able to cope with stress, and you know stress can be eustress or it can be also bad stress. The fact that you have won a lottery can be stress enough to increase your blood pressure. Some people, a man, the fact that he has gotten a baby boy that he was looking for already can increase the blood pressure. It is stress, but of course it increases your heart rate and also increases your blood pressure. Also, stress can be on the negative. It could be stress that you've lost a loved one, you've lost a job, there's some money that you're invested, maybe in cryptocurrency, and you've lost all of it. That is a stress. So that one can make your blood pressure to go high. Remember, when your pulse rate goes high, your blood pressure also goes high. What other thing? Pain. And we began by learning about pain. Why? Because pain can cause your blood pressure to go high. And one of the things as medics in hospitals, you know what we do? Whenever patients are admitted, they're in ICU, they're unable to talk. But you look at the machine, at the monitor, and you see the pressures are going high. Maybe you have not given the patient the pain meds, you go and check. This patient could be in pain. That's why the blood pressure is increasing despite being on high blood pressure drugs. So pain also can increase your blood pressure. So if you find a patient coming to the ED, that is emergency department, and you don't sort their pain, and you keep on saying their blood pressure is increasing, if you sort their pain, you'll be shocked that after an hour or 30 minutes, the blood pressure might go down. So pain also can be another indicator. One other indicator of something that can affect your blood pressure is exercise. Somebody who is docile, dormant, they've not been doing anything, just been seated or sleeping down, when it's lying down, if you check their blood pressure, it might be normal. While somebody who has been out walking, maybe they were rushing, running after the ferry, or rushing with time to clock in, when you check their pressure, you'll find it is high. Why? Because there's increased demand of the heart to pump blood. Remember, high blood pressure or blood pressure is the pressure that is exerted into the system or the arteries and the vein and the heart because of the blood volume that is moving within the system. So exercise can also affect. I want us to go into another thing. But before we go to that, I want us to take a break and just meditate on these 5 things that you talked about that can affect your pressure. Your age, your gender, the stress levels, the pain, and exercise. So subscribe, like, and channel, and let's continue to learn about blood pressure and how your blood pressure can affect you. Tune in. Back to my channel. I'm your host, Celessa Mary _RN. That is my YouTube channel. You can also watch me on My Health is My Wealth, and you can know that I am your educator, and I'm here to educate you. I'm here to empower you. I'm here to make your life better because your health is your priority. So we've been learning about what are some of the things that can increase your blood pressure. And I want us to continue. We have still 5 more things that can increase your blood pressure. Weight. There is a higher probability that the more weighty you are, if you are overweight, the more your blood pressure goes up. So you could be all female, you could be all 32 years of age, you could be all in the house seated, you've not gone anywhere to do anything. You all could be all having no stress. But the fact that one of you is 100 kgs or 80 and the other one is 60 kgs already changes everything. The blood pressures go high. That one does not exclude the fact that there are people who look slim and slender, but their blood pressure is also high. So, but scientists have discovered, majority in the distribution curve, that if you are overweight, then there's high likelihood of you developing pressure. Why? Because the heart has got more effort, has to exert more effort. And sometimes even the blood vessels, the arteries and the veins have fat or they are clogged. So it exposes you, thinning up your blood vessels, thinning up your arteries, making your heart, the valves to be weaker because there's more and more effort that the heart has to do to pump the blood to the rest of the body because of your weight. So weight is a contributor of the same. Another thing that is a contributor is race. It has been discovered that blacks have got higher blood pressures than whites or Caucasians. So we don't know the rationale behind it, but the fact that you're born in Africa and you're black, then just know you're more predisposed, all the conditions constant, to get higher blood pressure. Another thing that we ignore a lot is diets. What do you eat? What you eat can make your blood pressure go up or make your blood pressure go down. So one of the things, I have a late professor, and I want may his soul rest in peace, that taught me, that he told me that in 1982 there was no salt in Kenya. No salt in the sense that the table salt that is so available in our homes right now, cane salt, whichever salt it is, was never available. It was introduced in 1982 in Kenya. But before that, our fathers, our great-grandfathers were using the salt. They had a way of using, so they never had table salt at all. Maybe they used magadi, I don't know, whatever it is. I've always asked my mom, they said in the river there could be some stones that were ground, and as the stones were being ground very well, the stones were being used to make the food tastier. But unfortunately, in 1982, the issue of salt was now introduced in a massive way, that people could now use table salt. And my professor, Professor Abdullah, may his soul rest in peace, he used to tell me this story. At that time, we had in the hospitals, it was recorded that there was an increase in people who were having blood pressure. Pressures were becoming very high. So the table salt that we have in our houses, how well are we using it, or how badly are we using it? If you take food that is high in sodium, there is a high likelihood that your blood pressures will always be going high. So avoid adding salt on the table. What do? Make sure you cook food well with salt, but don't have additional table salt. Yeah? Adding already food that is cooked with salt, adding salt on top of it. It has been found that high sodium increases your blood pressure. Also, food that is canned food, canned beans, canned omena, canned this, all the canned foods, they use a lot of sodium to preserve, because salt is a good preservative. So canned foods also have high level of sodium. So the more you are eating more canned foods, the more you are predisposed to having high blood pressures. So when the doctor asks you, what did you eat? What is your diet? Don't be offended and like, why is he prying into my privacy? All those questions that are normally asked in the hospital are there to help us or to assist us to know your body better. Another thing that is very, very important is medication. Are you on any medication? There are some medication that increase your blood pressure, and there's some medication that lower your blood pressure. So, could be you are not diagnosed with high blood pressure, but you are on drugs that are assisting you for other conditions. They could be family planning drugs. There could be drugs to take care of your sleeping issues. There could be drugs to take care of your stress levels. All those drugs can either lower or increase your blood pressure. So it is always good to give a history when you ask, are you on any medication? Yes, I am. I'm taking this and this drug. We have had drugs of people who are asthmatic. Those ones also increase the heart rate. Salbutamol, the inhalers, you find some increase the heart rate. So always be honest with whatever drug you're taking, because that one helps to know, or helps the doctor to say, to know whether this patient, because they're on this drug, that's why maybe their blood pressure is low, so that they don't intervene. They don't add you more drugs, and yet the reason is maybe the drugs that you're taking for this particular moment to cure a certain disease or a certain condition. Now, one last thing about some of the things or factors that can make your blood pressure either go high or low is position. If I take your blood pressure when you're seated or when you're lying down, if you're lying down, your blood pressure will always be low. Why? Because your heart is at rest. Not at rest, but your body is at rest. So you're not exacting anything. So blood pressures taken when you're lying down are a bit lower. Taken while you're seated are a bit higher. So position affects your blood pressure. Because I told you, always when you're taking your blood pressure, make sure that your hand, if you're taking while seated, your hand is placed in such a way that is in tandem with your heart. Very, very important. Blood pressures. How well do you know about your blood pressure? It is very, very key to know all these factors and be honest to your healthcare provider so that you can know how you can be assisted. What are some of the factors, or what do you do? You've considered all these factors, you've talked to your doctor about all these factors, and then you've been diagnosed with high blood pressure, for instance. Your doctor will always give you a regime. You'll always be told now diet and make sure you avoid high salt diets. And nowadays you have alternatives to salts. Very good alternative. We have sea salt that has been found to be very effective. So your tongue, I want you to know this, my viewer, that whatever you train your tongue to do, your tongue will always obey. And it is the discipline. A small child who is born does not know anything. The only thing that a baby who is born knows is to cry. Then they begin to learn that there is a breast milk from the mother. And did you know that breast milk is not so sweet as we think? It is sweet to the taste buds of the baby, but not to the taste buds of my taste buds or any other person's taste buds. It is not sugary. It is actually, it's between non-sugary, something there. Very little sugar, lactose in it, if I may say. But the tongue of a baby loves breast milk. They will drink it because that was the first thing that was put on their tongue. If you train a child that they can start taking sweets, giving them lollipops at a very tender age, their taste buds will get used to salt, to sweets. The same way, if you're used to putting a lot of salt in food, you start training a child at that level, they will know. So, but you can also unlearn. Human beings are the beautiful thing with all human beings. You can learn and unlearn. So you can train yourself to start taking little salt. So one of the advices that we normally give to people with high blood pressure, we tell them you have to change your diet. We tell them you have to exercise to reduce your weight, because weight gain increases blood pressure. We tell you if you are stressed, you need to do something about your stressors. See a counselor, formal or informal. There's nothing you can do about your age, because as years go by, you always grow older. But there's something you can do about your diet. There's something you can do about your exercise. There's something you can do about pain. So very, very important. Once you manage whatever your mind, there are drugs that you'll always be given. So we have hypertensive drugs. And one of the things that people get a challenge is that blood pressure, high blood pressure has been known to be called a silent killer. And I want to caution you, my viewer, because when your blood pressure is very high and you're given drugs and you don't comply, then you're putting yourself at risk. So what are some of these complications of not following up the regime of the blood, of the drugs you've been given by your doctor? I want you to stay tuned as we continue to learn about what are some of the complications of having very high blood pressure and having very low blood pressure. So subscribe, tune in, like my channel, and let's continue to learn about blood pressures, because blood pressure is important and we need to know how to take precautions in case it goes high or in case it goes low. Stay tuned, share and like Celesta Mary _RN. So welcome back to my channel. I just want you to know that we have been learning about blood pressures, and the issue of high blood pressure, sometimes it varies in families. There are families that you know that the grandfather, the great-great-grandfather had high blood pressure. Such families, you know, if you belong to such a family, you're more predisposed. You are highly likely to get blood pressure. If you come from a family where they have cancers, your grandmother had cancer, your grandfather had cancer, also you are highly likely of developing cancer. So with blood pressure, if you have a family, your brother, your sister, your father, a relative has blood pressure, then know you are highly predisposed to getting it. So you need to observe your weight, you need to check your sodium your eating habits, you need to exercise them more, you need to make sure that you're observing your diet and you're following the regime that the doctor has prescribed. So you have been diagnosed with high blood pressure. You've been given instructions on what to do, but one of the instructions that we healthcare workers always stress up is abiding or following up with the medication. If there are any drugs in this world that should not be stopped, is drugs for high blood pressure. And you'll always be told. Why? Because high blood pressure is a silent killer. You will not feel that your pressure is rising. The people who come, they're very calm, and you check their vitals, they come for free medical camps. And as you're taking the blood pressure, you're seeing it is 160 over 120. And they look so calm. You ask them, are you stressed? No. What is happening? Have you been exercising? Or were you walking as you're coming? No. And they are shocked because they're not feeling it. Actually, people who have had high blood pressure, they start feeling it when it's now extremely high. And when they start feeling in their body. And it's unfortunate that some people start feeling it when it's too high. And now the blood vessels have ruptured because the pressure is too high. There is bleeding in the brain. Somebody goes into stroke. It becomes a real challenge. You need to follow the orders. The drugs, taking drugs every day. I know it's not an easy thing, but the more you avoid taking, you skip. Today I feel like I have a pressure, let me take, or let me not take. Do you know blood pressures normalize? Make sure that the arteries and the veins and your heart is functioning at a level that there could not be any complications. But the moment you stop abruptly, then they can easily escalate to a very high level and even cause your death. We've had people who get a heart attack, fell down and died. They were talking, they were giving a speech, they just fell down and died because it is a silent killer. High blood pressure kills many people than any other thing. So if you have been diagnosed with high blood pressure, take your drugs, whether you feel like it, whether you feel like you have a pressure or not. High blood pressure is not like asthma. With asthma, you can always tell, I feel like my chest, I'm almost going to get an attack, asthmatic attack. But with high blood pressure, you all feel like I'm almost going. When you feel you are feeling it, that is the time it is at the highest level and it might damage you. Very high blood pressure can damage your eyes. High blood pressure has been known to affect even the sexual prowess. Some men become dysfunctional, they can no longer function sexually. Some women interest goes away. So you need to follow the regime that has been prescribed. And you need to see your doctors, follow-up visits. I know this is one of the things that is very funny. Some people feel that medics keep on stressing that you need to come to the hospital after 2 weeks for what? I'm feeling okay. But you need to know that follow-up. That blood will be taken away, check your cholesterol level, it will check all the other levels in your body. Can be a good indicator to tell us where this medication is doing well with you or not doing well with you. Ladies and gentlemen, my dear listener, today we need to know about blood pressure, how to prevent it, how to be very careful about it, how to behave ourselves, and what we need to do so that we are there and prevent early deaths. Thank you so much for listening to me. I'm your host, Celesta Mary _RN, and your health is your priority. Know your blood pressure, know how much it is. Don't wait until you go to the hospital to know your blood pressure. We have people who are monitoring their blood pressure at home. You can buy a machine, use it to measure, know the normal levels. If you're seeing anything that is going beyond the normal, you need to see the doctor and you need to get treated as soon as possible. Never stay in the house with somebody with high blood pressure. If you have somebody who has high blood pressure, you need to strict adherence to your drugs. Follow the doctor's orders. Low salt diet. Do exercise. Lose weight, because all these are factors that can cause your death or can cause permanent disability. Because if you get a stroke, obviously one side of it can affect one side of your body, and this can cause problems in future, even in your own quality of life. So high blood pressures are bad. We also have low blood pressures. Very low blood pressure can also cause you to die. So you need to know and have a balance. So the patients are getting drugs to increase their blood pressures. So if your blood pressure is extremely low, it can make you feel dizzy. If it's extremely low, it can fall. You should not drive with very low blood pressures. So always important to know what is your normal blood pressure, and if there are any deviations from the normal, you need to seek medical advice. Why am I saying this? Because your health is your priority and your health is your wealth. So I have been your host, Celesta Mary _, and thank you so much for tuning in to learn about blood pressure, and I hope you have learned a lot. I want you to go to my channel. I want you to subscribe so that you can listen to more trainings on your health, because your health is your priority. So with that, I want to say good night. Just ask a question, like and share, and have a good night, good morning, and good afternoon, wherever you're watching me. And thank you for tuning in today. Asanteni sana.